Imagine this. You're starting your day with a healthy breakfast, a ritual many of us cherish. You're eating half a grapefruit, its vibrant color a promise of the goodness to come. The sun streams through the window, illuminating the fruit's juicy segments. It's fresh, juicy, and packed with vitamins, a seemingly perfect way to nourish your body and prepare for the day ahead. The tangy aroma fills the air, awakening your senses and invigorating your mind. You savor each bite, enjoying the burst of flavor as the juice tingles on your tongue, a delightful sensation that signals the start of a new day. You feel invigorated, ready to tackle whatever challenges the day may bring, armed with the energy and nutrients from this seemingly harmless fruit. Little do you know, this seemingly harmless fruit could be setting off a chain of events with potentially serious consequences. This isn't just about a simple food choice. It's about understanding the hidden complexities of how food interacts with our bodies, especially as we age and our bodies become more sensitive to these interactions. We often think of food as purely beneficial, a source of energy and nutrients. But the reality is that certain foods can have unexpected effects, particularly when combined with medications. It's a delicate balance, and understanding this balance is key to maintaining our health and well-being. But within hours, the pleasant start to your day takes a dark turn, a stark contrast to the optimism you felt just moments before. Your blood pressure drops suddenly, leaving you feeling lightheaded and weak, as if the ground is shifting beneath your feet. Your heart starts to race erratically, pounding in your chest as if trying to escape, a frantic rhythm that fills you with unease. You feel weak, your limbs heavy and unresponsive, making even simple movements a struggle. Confused, you struggle to grasp what's happening, your thoughts muddled and unclear, like trying to navigate through a dense fog. Dizzy, the room spins around you, making it difficult to stand or even sit upright. A disorienting sensation that amplifies your fear. You reach out for support, desperately trying to regain your balance and find some stability in the chaos. Panic sets in as you realize something is seriously wrong, a primal fear gripping your heart. You try to remember what you ate, what you did, searching for any clue that might explain this sudden and alarming change in your health. Was it something you ate? Was it a virus, or could it be something else entirely, something you haven't even considered? The feeling of helplessness washes over you as you struggle to understand what's happening to your body, a sense of vulnerability that leaves you feeling exposed and alone. What happened? What could have caused this sudden and frightening episode? You might immediately suspect a new illness or a sudden allergic reaction, the usual suspects when our bodies betray us. But the culprit might be something far more subtle. Something you wouldn't ordinarily consider dangerous, hiding in plain sight. It wasn't the pill you've been taking for years, the medication you rely on to manage your health and maintain your quality of life. It was the grapefruit. That seemingly innocent fruit you enjoyed with your breakfast is now revealed as the source of your distress. The grapefruit has interfered with the way your body processes your medication, leading to a dangerous buildup in your system. This interaction can amplify the effects of the drug, causing a range of adverse reactions, from mild discomfort to life-threatening complications. It's a stark reminder that even natural foods can have powerful effects on our bodies, especially when combined with medications. This seemingly harmless fruit can turn into a silent saboteur, disrupting the delicate balance of our internal systems. Today we're going to talk about something most people, even many doctors, don't talk enough about. The surprising and potentially dangerous interactions between grapefruit and certain medications. We'll delve into the science behind this phenomenon, exploring how grapefruit can interfere with the body's ability to process drugs, leading to a range of adverse effects. We'll uncover the specific enzymes involved and how grapefruit compounds can inhibit their function, disrupting the normal metabolism of medications. How grapefruit can dangerously interact with medications, especially in older adults, whose bodies are often more sensitive to these interactions. We'll examine the specific medications that are most likely to be affected by grapefruit, providing you with the information you need to protect yourself and your loved ones. This includes common drugs for treating high blood pressure, cholesterol, and even certain mental health conditions. We'll also discuss the importance of open communication with your doctor and pharmacist, ensuring that they are aware of all the medications and supplements you are taking, as well as your dietary habits. This knowledge is crucial for making informed decisions about your health and avoiding potentially harmful interactions. So, join us as we unravel the mysteries of grapefruit and medication interactions, empowering you to take control of your health and well-being. Grapefruit. It's a seemingly innocent fruit, often enjoyed as part of a healthy breakfast or a refreshing snack. But beneath its tangy sweetness lies a potential danger, especially for those taking certain medications. Grapefruit isn't dangerous by itself. The problem is how it interacts with your medications. It's not about the fruit being inherently toxic, but rather the complex chemical compounds it contains and how they interfere with the way our bodies process drugs. This interaction can lead to unexpected and potentially harmful consequences, turning a simple dietary choice into a significant health risk. We need to understand the mechanisms at play to make informed decisions about our diet and medication use. The key lies in understanding the specific enzymes within our bodies that are affected by grapefruit, and how this disruption can alter the intended effects of prescribed drugs. It's a complex interplay of natural compounds and biochemical processes, and understanding it is crucial for safeguarding our health. Inside grapefruit are chemicals called furanocoumarins. These compounds are naturally occurring and are responsible for the unique flavor profile of grapefruit. However, they also possess the ability to block a key enzyme in your gut and liver, called CYP3A4. This enzyme plays a crucial role in breaking down and metabolizing a wide range of medications. When furanocoumarins interfere with CYP3A4, they disrupt the normal metabolic process, leading to altered drug concentrations in the body. The amount of furanocoumarins can vary depending on the type of grapefruit, with some varieties containing higher concentrations than others. This variability adds another layer of complexity to the interaction between grapefruit and medications. It's important to note that this effect is not limited to just grapefruit. Other citrus fruits like Seville, oranges, and pomelos also contain furanocoumarins and can potentially interact with medications in a similar way. So it's not just grapefruit juice you need to be mindful of. The whole fruit and related citrus varieties can pose a risk. This enzyme, CYP3A4, is like your body's traffic cop for medications. Think of it as a gatekeeper that regulates the flow of drugs into your system. It controls how much drug gets into your bloodstream. Without this enzyme functioning properly, the levels of medication in your body can become unpredictable and potentially dangerous. The enzyme works by breaking down the drug molecules, reducing their concentration before they reach their target sites. This process is essential for maintaining the correct dosage and preventing excessive accumulation of the drug in the body. When grapefruit interferes with this process, it's like removing the traffic cop from the intersection, leading to chaos and uncontrolled traffic flow. The consequences of this disruption can be significant, as the body is no longer able to effectively regulate the amount of medication it absorbs. It's a delicate balance, and grapefruit can throw that balance completely off. When grapefruit blocks that enzyme, CYP3A4, your body can absorb too much medicine. The drug is not broken down as efficiently, leading to a higher concentration in your bloodstream. This can amplify the effects of the medication, both intended and unintended. Even your regular dose can become an overdose. What would normally be a safe and therapeutic amount of medication can suddenly become toxic, leading to a range of adverse effects. The severity of these effects can vary depending on the specific medication, the amount of grapefruit consumed, and individual factors such as age, genetics, and overall health. In some cases, the interaction can lead to serious complications, requiring hospitalization and medical intervention. It's crucial to be aware of the potential risks and to take precautions to avoid this dangerous interaction. Always read the warning labels on your prescriptions and over-the-counter medications, and when in doubt, consult with your doctor or pharmacist. And if you're over 60, your metabolism is slower. As we age, our bodies naturally become less efficient at processing medications. Our organs are more sensitive. The liver and kidneys, which play a crucial role in drug metabolism and elimination, may not function as effectively as they once did. This means that drugs can stay in the body longer and reach higher concentrations, increasing the risk of adverse effects. That's why grapefruit is especially risky for seniors. The combination of a slower metabolism and the enzyme blocking effects of grapefruit can create a perfect storm, leading to potentially dangerous drug interactions. It's essential for seniors to be particularly cautious about consuming grapefruit or grapefruit juice while taking medications, and to consult with their healthcare provider to ensure their safety. The potential consequences of this interaction can be more severe in older adults, making it a critical consideration for their overall health and well-being. Remember, proactive communication with your healthcare team is key to managing your medications safely as you age. Let's start with the most dangerous group: heart and blood pressure medications. These medications are often prescribed to manage a range of cardiovascular conditions, from hypertension and high cholesterol to arrhythmias and heart failure. They play a crucial role in maintaining heart health, improving overall well-being, and preventing serious complications like heart attacks and strokes. But it's essential to be aware of potential interactions with certain foods, and in this case, especially grapefruit. These include commonly prescribed drugs like amlodipine, nifedipine, and felidipine, all calcium channel blockers used to lower blood pressure by relaxing blood vessels. Then there are antiarrhythmics like amiodarone and dronedarone, which help regulate heart rhythm and prevent life-threatening arrhythmias. And yes, surprisingly, sildenafil, also known as Viagra, also falls into this category due to its effects on blood vessels and blood flow. It's a diverse group of medications, each with its specific mechanism of action, targeting different aspects of cardiovascular function, but they all share a common vulnerability when combined with grapefruit. Understanding this interaction is paramount for patient safety and medication effectiveness. It's not just about avoiding discomfort, it's about preventing potentially life-threatening situations. We need to delve deeper into why this seemingly innocuous fruit can pose such a significant risk when taken with these medications. The key lies in the way grapefruit affects the body's ability to process these drugs, leading to potentially dangerous consequences. So, let's explore the science behind this interaction and learn how to protect yourself or your loved ones from harm. Remember, knowledge is power, and being informed about potential drug-food interactions is a vital part of responsible healthcare. Taking proactive steps to understand these risks can significantly improve your health outcomes. These medicines are carefully designed to lower blood pressure and relax blood vessels, improving blood flow and reducing the strain on the heart. They work by targeting specific pathways in the body that regulate blood vessel constriction and dilation, ensuring that blood can flow freely and efficiently. But grapefruit contains compounds called furanocoumarins, which can significantly amplify their effect, leading to unintended and potentially harmful consequences. These compounds interfere with an enzyme in the liver and intestines called CYP3A4, which is responsible for breaking down many medications, including those for heart and blood pressure. Think of CYP3A4 as a crucial quality control system for medications in your body. When CYP3A4 is inhibited, the body is unable to metabolize the drug properly, leading to higher concentrations of the medication in the bloodstream. This increased drug level can then lead to exaggerated effects, potentially causing a dangerous drop in blood pressure or other adverse reactions. The animation you're seeing illustrates this process, showing how grapefruit essentially boosts the potency of these medications beyond their intended levels. It's like turning up the volume on a stereo system too high, resulting in distortion and potential damage. The intensity of the interaction can vary depending on the amount of grapefruit consumed and the individual's metabolism, but even a small amount of grapefruit juice can have a significant impact. This is why healthcare professionals strongly advise against consuming grapefruit or grapefruit juice while taking these medications. The risk is simply too high, and the potential consequences can be severe. It's a simple precaution that can make a world of difference in your health and safety. The consequences of this interaction can be quite alarming. You might experience a sudden and precipitous drop in blood pressure, leading to dizziness, lightheadedness, and even fainting. This can be particularly dangerous for older adults who are more prone to falls and injuries. Falls can lead to fractures, head trauma, and other serious complications, significantly impacting their quality of life. In addition to low blood pressure, grapefruit can also cause an irregular heartbeat, or arrhythmia. This occurs because the increased drug levels can disrupt the electrical signals that control the heart's rhythm, leading to erratic and unpredictable heartbeats. An irregular heartbeat can feel like palpitations, fluttering, or a racing heart. And in some cases, it can be life-threatening, potentially leading to cardiac arrest. In severe cases, the interaction between grapefruit and these medications can even lead to a stroke or heart failure. A stroke occurs when blood flow to the brain is interrupted, causing brain damage and potentially leading to long-term disability. Heart failure is a condition in which the heart is unable to pump enough blood to meet the body's needs, leading to fatigue, shortness of breath, and other debilitating symptoms. These are serious and potentially fatal complications that can arise from something that seemed as harmless as a piece of fruit. It's important to remember that the severity of the reaction can vary from person to person, but the risk is always present. Don't underestimate the potential danger of this interaction. It's always better to err on the side of caution and avoid grapefruit altogether if you're taking medications for heart or blood pressure. Your health is worth more than a glass of grapefruit juice. If you take medications for heart or blood pressure, avoid grapefruit completely. This isn't just a suggestion. It's a critical warning that should be taken with the utmost seriousness. The potential risks are simply too high to justify consuming grapefruit in any form. This includes grapefruit juice, fresh grapefruit, and even grapefruit-containing products like marmalade or certain cocktails. Be extra vigilant when dining out or purchasing pre-made foods. Read labels carefully and be aware of hidden sources of grapefruit. The good news is that there are plenty of other delicious and healthy fruits you can enjoy without worrying about drug interactions. Oranges, apples, bananas, and berries are all safe alternatives that provide essential vitamins and nutrients, contributing to a balanced and healthy diet. Talk to your doctor or pharmacist if you have any questions or concerns about grapefruit and your medications. They can provide personalized advice and help you find safe alternatives, ensuring that your medication regimen is both effective and safe. Your health is too important to risk. By avoiding grapefruit, you can ensure that your medications work as intended and protect yourself from potentially dangerous side effects. Remember, a little bit of knowledge can go a long way in safeguarding your well-being. So, make the smart choice and steer clear of grapefruit if you're taking heart or blood pressure medications. It's a simple step that can make a big difference in your overall health and safety, allowing you to live a longer, healthier, and more fulfilling life. The next group, statins, the most common cholesterol drugs. These include simvastatin, atorvastatin, lovastatin. They help prevent heart attacks and strokes by lowering bad cholesterol. But grapefruit makes these drugs too strong. The result? Severe muscle pain, weakness, inflammation of muscle tissue, even kidney damage. Some people have ended up in the hospital just from combining grapefruit with their cholesterol pill. Next up, mental health medications. Alprazolam, diazepam, triazolam, for sleep or anxiety. Buspirone, a mild tranquilizer. Sertraline, escitalopram, for depression. Grapefruit increases their effects too much. Seniors may experience extreme drowsiness, confusion, memory issues, a high risk of falls and fractures. At night, it can even suppress breathing in your sleep. These are medications that need balance, and grapefruit throws off that balance completely. Blood thinners prevent strokes, clots, and heart attacks. Common ones include apixaban, rivaroxaban. They're essential for many seniors with heart rhythm issues or clotting problems. But grapefruit enhances their thinning effect dramatically. That leads to dangerous internal bleeding. In your stomach, your intestines, even your brain. These bleeds can be silent and deadly. It's not worth the risk. What about when you're sick? Two common antibiotics, clarithromycin and erythromycin, are also affected by grapefruit. The problem here isn't bleeding or sedation. It's your heart rhythm. These antibiotics can cause a type of arrhythmia when combined with grapefruit. And in people with weak or aging hearts, that can be life-threatening. Some people, especially transplant recipients, take drugs to suppress their immune system. Examples: cyclosporin, tacrolimus. These drugs are powerful and need precise doses. Grapefruit interferes with that precision. The drugs can become toxic, harming your kidneys or liver, or worse, become too weak, allowing your body to reject a transplanted organ. Grapefruit is healthy, but only if you're not on these medications. So what can you do? Read your medication leaflets. Ask your doctor or pharmacist, is grapefruit safe for me? If you're unsure, avoid it entirely. There are plenty of safer options. Oranges, apples, pears, kiwis. Fruits can heal you, but they can also hurt you when mixed with the wrong medicine. Always check. If you're over 60, your body is more sensitive. That's not weakness. It's wisdom earned over time. Take care of your body the same way you'd care for a loved one. And share this video with your parents, neighbors, or friends. This one small tip to avoid grapefruit could save a life.